I was attacked. She just bit my nose off.
We had a lot of doctors that we went to said it couldn't be done or just didn't care.
Out of 21 doctors, only one person would see my case.
This is a complex problem with no easy answer. And I'm not saying that I have the answer today, but I think I do.
I was actually a little skeptical about the whole thing until I met Dr. Calvert. Everybody else was either telling us they can't do it, or it was an extreme method to fold off the forehead and this and that. He had an energy flow. He was excited. He was confident. It's like he knew this was going to work and he was going to make it work.
I think, other surgeons who've seen her looked at it and said, well, we got to put the tissue back. But all the tissue's already there. It just takes some thought to see beyond the defect.
The defect is, is significant because of its location. I think my plan is going to work very well.
Instead of trying to put new tissue there and make her this, big nose that she might have had before, I'm actually going to try to create a beautiful nose for her. And it's a very different approach.
I've been walking around the building most of the time and pacing back and forth. I've been real nervous.
It really came together beautifully. Very, very difficult operation. There's no question that there are a lot of moments in that operation that there were a lot of choices that we just had to kind of pick one and go with it. But the reality is that at this point, anybody who looks at her is going to see a nose. And that was the idea, is to make her face go from a face with a major defect to a nose.
Thank you.
You are very welcome. It's my pleasure, and we'll get you back there to see her in just a minute.
I appreciate it.
Good, absolutely.
I'm hoping this is a chapter that will come to a close and open up some great brand new doors for us.
I am a motivator and a patient advocate, a person advocate. That's what I do. I use surgery, it's a tool, but my real goal here is to give Jennifer back herself.
Can you hug me?
Yes, you can hug me. Just don't touch the thing.
I won't.
Be careful.
I think what I do for Jennifer has a lot more to do with the hope that I give her.
It's wonderful.
And I'll take care of her for the rest of her life. We're now joined at the hip. She's my responsibility, so that's where I'll be, and that's where she knows I'll be.